Though this child has suffered a raging fever for 4 days, the mother kept the child at home in the hope that the fever would subside on its own. Since the health center was closed over the weekend, this mother was the first to arrive here on Monday morning at Kaita Health Center 2 in Mubende district. Luckily, the nursing assistant who heads this clinic tells us this mother and her baby have received the last remaining dose of Coartem, the first-line drug used to treat malaria. She says even if there's a stock out, they always get drugs within a period of about 2 weeks. Even then, some of the drugs do not run out. On average, this health center too sees about 85 patients a day, most of them women and children. Like in many parts of the country, most of them are suffering from malaria, respiratory tract infections and diarrhea. But since there are no lab tests done here, everyone who comes in with fever is almost certainly given a dose of antimalarials and some antibiotics. That's why these two medicines run out very fast. The nursing assistant says they last received a batch 2 months ago and isn't aware when the next consignment will come. In the meantime, all these people will be told to buy from drug shops.
The drugs actually do get shortages, it's true. As we have said, of course, the number is quite big compared to the drugs we get. We advise actually patients to go and buy some of these drugs.
In 2009, government changed the system of supplying medicines from giving the districts money to buy their supplies to letting the national medical stores buy all the medicine. Under this system, NMS sends prepackaged supplies of essential medicines to lower-level health units, while health center fours and hospitals can request for specific drugs. While the new system of supplying medicines has reduced cases of money for medicines being misused by the districts, there are still challenges, especially at lower-level health centers.
We have already requested the district test team and they are compiling now the list so that actually they can increase on some of drugs, also decrease even some drugs which we may be a bit, we may not actually need.
The supply system is not the only problem causing stockouts in health centers. A HEP study tracking the budgeting, financing and delivery of medicines following the policy shift shows that inadequate funding for these essential medicines is also a major cause for drug stockouts.
The situation is far worse than you would expect. For example, some districts were getting less than 1,000 shillings per person per year. With such kind of funds, we're still a very long way to achieve access to medicines.
The second health sector strategic plan recommends that government should spend an average $28, approximately 65,000 shillings per person per year for essential medicines alone. The study also shows that most hospitals, including regional referral hospitals, do not have qualified personnel such as pharmacists to make orders for drugs. And out of the 41 health centers visited in the study, only 4 had vehicles for delivery of medicines.
Most of the facilities do not even have a way of contacting, say by telephone or email, of contacting the district to know if medicines had actually received and if they had to be picked.
Some, like Mbende now, we're a bit lucky we have some vehicles. We use the vehicles at the district and the health sub-districts. But we also get problems sometimes when there is no fuel.
All these reasons have made drug stockouts in public health centers inevitable, forcing people to resort to the private sector. Though the problem of drug stockouts seems to have improved, most of the patients coming out of Mubende Hospital say they've been asked to buy 1 or 2 drugs from elsewhere. This one says they've told her to buy the drugs if the child is found to have sickle cell disease. Yet other studies have shown that prices for medicine in Uganda's private sector are too high, about 3 to 4 times higher than international prices. This results in poor people buying incomplete doses, thereby misusing the medicines, while those that are not lucky may end up dying. Anna Tkunda, NTV, Weekend Edition.